Mohammed Haytham gently tightens the dirty cotton strips tying his father's arms to his bed. The strips prevent Abbas, the father, from hitting himself or staff members when he convulses. Abbas was diagnosed with COVID-19 3 weeks ago, and every day he is getting sicker.
When he first became ill, the symptoms were minor, but then he got a high fever. We brought a doctor and medicine to the house, but he did not get better. It was hard for him to breathe.
Doctors say northeastern Syria, an isolated region of about 5 million people, is reeling from the worst wave of COVID-19 it has seen since the pandemic began. This specialized hospital hosts scores of patients at a time. Most staff and nearly all the patients are not vaccinated.
The vaccination rate is very, very small. No one who has come here has been vaccinated. Maybe 1 person in 1,000 has it.
Health officials say the region has only enough vaccines for about 2% of the population. And even more alarmingly, infection rates are soaring, with the death rate rising by 50% over the last 2 months. The region is also short of key supplies, like oxygen and tests.
During new waves of the disease, like now, there is a shortage of oxygen, and the whole process of providing oxygen doesn't work. If the wave is heavy, some hospitals have to turn patients away.
But on the streets of Qameshli, a city beleaguered by more than a decade of war, many people do not wear masks, saying they are not as worried about coronavirus as they are about the threat of violence and extreme poverty in Syria. The impact the pandemic has had on the economy, however, worries everyone.
The coronavirus has had a huge impact on our society. It has impacted the environment we live in and our economy. There are fewer jobs. We are in a crisis situation.
Some sellers say they will not get vaccinated because they cannot take time off from work. For them, missing even a few hours could also mean missing meals. And hunger, they say, is more frightening than the pandemic. Heather Murdock, VOA News, Qameshli, Syria.